You cannot be very proactive about when you are using that chemicals. For example, in in housekeeping, generally they are using some chlorine-based chemicals. If you are very frequently using those chlorine-based chemicals without any safety gloves, you will have a very big consequences on your skin. Your skin might get damaged. You will have a very big issue like itching issues. Somewhere you will feel that their skin becomes some coarse like this. So this is very important. When you are dealing with chemical, you should have to take care, and you have to follow some steps and some precautionary steps like always wearing gloves. That gloves should be chemical resistant, and also when you should be a proper mask, especially these two is mandatory. Additionally, you can have, when you are dealing with the acid based especially, you should have a safety gloves also, because if accidentally if it splashes, that chemical just splashes goes into your eyes, it will impact your vision also. So it's just make sure when you are dealing all those things, any chemicals, these three things is minimum requirement. So now we will move forward. Coming to this, first we will try to understand. As I said, this is regarding what are the case, how we can safely handle the chemicals. So as per the Occupational Safety and Health Hazard, that's shortly called OSHA, term that denotes any chemical that would be a risk to employees if exposed in the work. So any chemical that may lead to any consequences, physical, maybe environmental, any hazard that associated with any chemicals. So OSHA has said that it should be taken care very, very proactively and very seriously. I gave one in one of my training sessions that one of my colleague, she was doing an experiment, and I don't know, actually I was not there, but I came to know that she was doing one experiment with acid. That acid was H2SO4, sulfuric acid, and she was not much serious about dealing with it, even though I think she has the knowledge about that H2SO4. But what happened during I think she was making just fun with her friends. So what happened, some of the quantity just splashes and goes on her hair also, and some also face. So the part where it just splashed, all that part got burned actually, her skin, hair and hair also. So this is very dangerous. And I think acid, in toilet I think someone is using the acid for as sanitizing actually, maybe the housekeeping team. Or chlorine is just chlorine.
Clorox, yeah.
Clorox only, yeah? It's chlorine. So a hazardous material is anything that is flammable. So now categorization. So how you came to know something is hazardous. So when something is flammable, it means it can easily be burned and can easily be make fire. Corrosive, reactive and oxidizer, toxic and carcinogenic. Carcinogenic means something that may cause you cancer. If you are not well prepared and when you are not using well, it may cause you cancer for a longer run maybe. Or breakdown to give a species with any of the above category. These are some of the, like acetone, here we are not using, but generally we are using in the labs, especially food-based lab or water-based lab or like this. Acetone is flammability. So you should have to know about the chemicals also. Before I have already given the chemicals and their, you have their OSHA's pictogram also. I gave this training that if this is the pictogram, what you will understand, like a skull base. So it means this is what? Dangerous, like this. So we try to understand what categories of the hazardous chemicals. First, it will be corrosive. Any hazardous chemical might have this property of corrosive. Then it will be flammable. Then it will be toxic, reactive, biologically infectious, and then carcinogen, which may cause you cancer, and there are some also chemicals that may release radioactive materials. So these in this case of radio, they are not directly, but when they come in contact with some others, may release some radioactive rays or waves. So what are the hazardous material states? In what states you can find? We have three generally. On the basis of there are some liquid, there are some solid, and there are some gases. For liquid, we can take examples. Here we have the liquid chemicals mostly, but there are some also solid that some camphor. But even camphor is very friendly to us, but still they are chemical based. Then we have the gas. We have the here. We have gas. Here also I think we don't using any gaseous chemicals. But there are some chemicals which I think release gas. When you are using perchloroethylene, is that any flame or anything released? No. Okay, so here fortunately we have only liquid based. So now how to handle chemical properly? When you are using any chemical, what are the procedures you should have to go through? First, use cautions. And from where you got this, from where you will know this, what type of chemicals you are using.
Chemical label already mentioned this.
That's good. Anything else? Exactly. One of the very important documents when it comes to chemical is MSDS. That stands for data sheet. Excellent. M for material, S for safety, D for data, and sheet, S for sheet. Somewhere also called SDS, safety data sheet. This is a document that having 16 sections. Each sections have some important information. If you are, for example, if you don't know what type of chemicals is that, you just prefer the MSDS. You will get all the information. What is this chemical name? How it's from where? Who is the manufacturer? How even there you can find there is section storage. Very important. We always bother how we have to store this chemical. You don't have to bother so much. You just have to prefer the MSDS. There you will find how much temperature. There should be ventilation, proper ventilation or not. Whatever their requirement, it will be there. I think MSDS is one of the best things you can prefer when you are dealing with any type of chemicals. Always follow the procedures. These procedures, maybe your official, you are making your own, develop your own, or sometimes the company itself provide you this procedure. That's called SOP, a standard operating procedures. Then read all labels. There you, on the chemical you will find some labels is there. On that also you can find some information. There is a UN number, that's called unique number. If you search that number, you will find easily all the MSDS for that. And each and individual chemical have their own unique number. You cannot find same unique number for both different chemicals. Keep yourself and the work area clean. It's very important, especially for the housekeeping people. The purpose is to make sure the cleanliness. And then plan ahead. Plan ahead is like when you have any situation. Then in that situation, how you will deal those things. That's why we have emergency spill response team. For individual, we have for the laundry, for the chemical store, we have individual. Even here, we have fire response team also. One, we have already CERCO, but internal we also have. For each building, I think there are housekeeping persons who also are well trained regarding how to respond when there is any fire incident happen. They have how there is a procedure, well set procedure we have made. And I think every building is already there. So these are the well planned. If any consequence, any such situation come, then how we can deal with those. Then coming to this, what are the routes of exposure? How you will get infected or how you will get contaminated with these. There are some major, one is inhalation. One of the most common part is the inhalation. It might be through, and it will goes to your lungs. And if your lungs goes choke, you might faint and maybe you will die. So that's why inhalation is one of the most and very common and dangerous also at the same time. Ingestion, sometimes. This happens very often that, for example, if someone has dealt with the chemical, for example, there is a spillage happen. And someone just cleaned and just removed all the spillage, and at the same time someone just offered him some food or something. And he, without any further, he just taken with the same hand whom he has cleaned and just ate the food. What will happen? Might be he will get infected for that. So ingestion is one of the second reason. Then absorption. Sometimes it follows your skin, all goes to your eyes, and that's injection. Something pin. There is some needles having some bacterial thing, like for example, if there is a patient suffering from the AIDS, and the same just, for example, due to the negligence of the doctor, he just throw that needle somewhere. And unfortunately someone got just injected with that. He will also have this disease. So that's very important. Now what are this, for example, if someone have contacted with that situation, for example, someone have inhaled, there is some, you can say, spillage, and in that someone has inhaled. Then in that case, what are the possible things he might suffer? For example, eye discomfort. Very, but you will feel irritation, your eyes may become red, something like this. Then breathing difficulty. If there is a gaseous, surely you will have this situation. you know, there is a most of the people I think they who belongs from India, they know there is a state called Bhopal. There one is very dangerous situation happened in 1984. That's called Bhopal gas tragedy. What happened? Anyone knows?
Methanol is issue.
Exactly, you are right. Further? Hmm? No, it was not bomb blast.
No, it's methanol alcohol.
Yes, actually this was tank number 4, I think. What happened? What was the principle? Just for brief I will tell you. What happened? There was a tanks. As per standard procedure, the tank have less than 50% of gas. That means methyl isocyanate. Rest it will be filled with the nitrogen gas. That day what happened? I think previously some supervisor also instructed this malfunctioning. But this is what happened when you are neglecting these situations. So what happened that day itself? The methyl isocyanate level goes rise. As per standard, it should be less than 50%, and rest will be filled with the nitrogen gas. But now it is way above. So what happened due to this situation? That burst all of a sudden, and after that, almost that state itself suffered more than 20 years due to that only. Generally, that time the woman who is pregnant, generally that time happened. What if she born a baby that maybe mostly have the disability? Maybe some have physical, like have no proper hand growth, these things, and it's happened till almost 20 years. So this is what happened when these things happen. It was big disaster. So next, dizziness, you will feel like this, and headache, nausea, vomiting, and then skin irritation. Second most important common thing is skin irritation, if you directly came in contact with the chemicals. Now, incompatible chemicals. Therefore, even I think in the laundry section, I have give you a chart. There it's mentioned that what are the compatibility of the chemicals. You cannot keep any chemicals with anyone because there is a condition. For example, if you put acid with base, what will happen? You know? Anyone from this acid and base? No, anyone? Yeah, exactly. It will react and it will cause disaster. Even though the final output will be the salt, but still that reaction is itself very vigorous, very flammable actually. When acid come contact with base, it overall forms salt, which is called as a neutral substance. But during this process, it causes high release of high energy, exothermic energy. That may cause you issue. Okay? So flammable and oxidizer, these are the some chemical, we cannot put these two. There is something flammable and then oxidizer, they are like enemies to us. Why? This oxidizer help in flammable. For example, if you have seen, if there is a candle burning, if you put glass on the candle, you will find after some time the that flame will extinguish. Why? Exactly, because after some time, initially whatever the oxygen was present there, they is consumed. But at the end, when there is no oxygen, the flame was extinguished. Same, but in case if there is something flammable, there is oxidizer means something you are giving them oxygen, so it will goes on. Next, flammable and any ignition source, like you are putting any flammable chemical and next to it there is some LPG gas or something. So these are combination of just acid and cyanides. These two combined release very toxic gas. Acid and cyanide, very toxic gas. It will cause headache and sometimes you will fall down and maybe you will have a heart attack also. This is the very dangerous gas. Then a strong acid and a strong alkalis. Alkalis, another word you can say base. So strong acid, there are 3 strong bases generally. Anyone knows? H2SO4, good one. Next. Excellent. Next. Anyone else? Third one is HNO3, that's called nitric acid. First is H2SO4, that's called, also in our general name, what we call? Sulfuric acid. And then HCl, hydrochloric acid. And the last one is HNO3, that's called nitric acid. Also called, these 3 called mineral acid. Why? Very stronger. Don't try to play with these, especially if they are concentrated. Concentrated means if it's something written 97% of HCl, it means there is 97% HCl and then only 3% in water. So it will if something nauseous, even small one splash is very dangerous for your skin, and because our skin easily got burned on that. And we have seen nauseous in our country and some other part of the country there is an incident of acid attack. Generally they use these chemicals. So concentrated acid, as I said, and the water. Never. This is very important. You are dealing with the chemicals, you should have to know there is two situations. Acid and water. In this, there is two situations. First, adding acid in water or adding water into acid, which is good practice. Let me go on. There you have water and you have acid. So which is good practice? I am giving you two situations. First, you are adding acid into water, first situation. Next, adding water into acid, second situation. Which is good?
Water to us.
Water to acid. Who is with his answer? Raise your hand, please. He said adding water to acid. Anyone?
Not the other way around.
Huh?
Acid to water.
Acid to water. And he said water to acid. Right answer is actually, yes, Mr. Santa, you are also saying. Acid to water. Excellent. The right answer is acid to water. There is some important thing that let me know. I just said concentrated. And there is two terminology in chemistry. I know maybe for someone it will bounce, but it's good for your knowledge. I know. So there is two situations. One diluted and one called concentrated. Literal meaning of these two is if something having high amount, that called concentrated. If something having less amount, in that reaction I am talking about, that called dilute. For example, if there is 100 ml of chemical, in that 10 ml is acid, 90 ml is water, then this will call as a diluted. Okay? Same, just different situation. If there is a 10 ml of water and 90 ml of acid, it will call as a concentrated. Now my question was that which we have to add. This is a very much you can affect if you are adding this situation. If someone is adding acid in water, what will happen? Acid amount will gradually increase. So in the starting, the concentration, which will be high amount? Water. So if you slowly add the acid in water, it will consider as a condition of diluted. So it will not cause much effect. But if you are adding water into acid, it will be like bomb. Very big issue. Never try. Very big. Even for the small acid, if you put the water, it will like, so very dangerous. So this is the situation. Now corrosive and the other reactive materials. Now there are some agencies that actually taking care of all these things. On that basis, if you are not following, even the Neom and any company will put you on penalty. For example, first is OSHA, that stands for Occupational Safety and Health Administration. Then we have NFPA, that's called National Fire Protection Association. Then we have EPA, Environmental Protection Agency. These are the Department of Transportation. Why DOT is important? Because generally we are transporting our chemicals. So while you are transporting your chemical, just make sure that it should be properly carried. Otherwise, what will happen? Allah knows best. Because there is one incident happened, I'm talking about the oil spill, just recently in the Red Sea. Almost 1 lakh liter of the oil just spilled in the Red Sea. It was disaster. Sometimes the country itself caused this as an emergency. Because it was caused so many issues. First, it will impact the aquatic life. That will cause the pollution of the air, water. So much cost to rectify these things. Then, chemical spill, what should you do? First, for any spill, alert others and close off the area. Very important. Stop the access. For that, we can follow so different steps. For example, if there is open area, you have no door and something, then in that you put the barricade. And if possible, if it's good that you have the signage, then put the only authorized person access here, like this. But if there is a door, a closed and confined space, in that just first thing, very important, evacuation. And in that, I think you already faced the fire drill also. You do what is the process? When you came back from the any incident, you just rush out. What happened? You always have a head count. Why is it important to head count?
Make sure that
Your friend and your colleagues, make sure that they are also safe. I know the situation itself, like you will save your first, and it's important. But second thing, you should have to make sure that your colleagues is also safe. If he's not safe, just let the authority know that he is inside, so that he will take action. That's very important in the head count. Okay? So use the chairs as tool to close all the part of the corridor if there is possible. Best thing is if you have any barricading like tape and you have the signages, put. Otherwise, you can also do this, like putting so that no one will access there. If necessary, you can use the fire alarm to clear the building. Where we have this, we can manually start, and obviously automatically it will always start. Now handling flammable chemicals, very important. Keep container closed when not in use. This is very important. And before I told you that always bring such quantity which is required. Don't bring bulk quantity. Because if Nauzubillah something happen, controlling bulk quantity is very tough. Because something like right now you have more than 1,000 liter, 2,000 liter, then it will be very tough for you to maintain and contain those chemicals. Keep away from the ignition source, otherwise it will become bomb-like things situation. Avoid contact with incompatible material. Before I just gave that we should, what are the things we should not accompany when keeping any chemicals. Then only transfer to the approved containers. Then we have the bond all the receiving containers. Whatever the container is, just check whether the seal is totally tight or not. Or is there any leakage. And for further, if you are putting, make sure it should be placed in drip trays. So to ensure that if accidentally if any spillage happen, it will contain only in the drip tray. And last one, clean up spill and dispose of waste properly. Very important. Now, how you should have to store flammable chemicals. Ensure that the storage area meets regulatory requirements like proper ventilation. If possible, put the AC there. Or we have to fresh air unit. We have generally fresh air unit like this. These are the minimum requirement. Replace all burn caps with the drum weight after receiving the containers. Ground all the drums properly. Like this, you cannot put a stack some, and you cannot just put like this. It should be always erected. When you are placing your chemical, it should always be protected. Don't like sometimes you just put in this. If you see, just put it erected. Then store quantities in approved storage room and cabinets. For this, we can maintain one log sheet called inventory log sheet. It's very important to maintain and update your inventory log sheet because it will give you information how much quantity you have stored and how much you have brought. It will give you proper information. That's why I always told all the department that when you are dealing with the chemicals, always ensure to maintain the quantity. How much you have received on which date and how many you are receiving day by day. Store only in the small quantities in the starting already. General safety. First, never eat, drink, or smoke while using the hazardous chemicals. Otherwise, it will cause you problem. Use proper PPE, that's called personal protective equipments as required. Make sure all the chemicals container are properly labeled and always wash up after using chemicals. It should be properly washed. Okay? Then never smell or test a chemical to identify. Very common it's happen. And we are very smart on this. Something like this, we start doing like this. But if chloroform, what will happen? You know chloroform? That is used to make you unconscious. Yeah. We have seen so many films that, especially I think one film, Jody Liver. He was trying to put iron, and after that he also put on it. So you have the same situation. So don't ever try to do this. So know all the emergency procedure equipment here we have. We have the contact number, we have everything here. So if any situation happens, just inform them. We have the help desk here and also other parties. Always read the Rebels MSDS prior to use. As I already told you, just always prefer MSDS. Everything is there. Store all hazardous chemicals properly and always use the hazardous chemical as intended. Whatever you need, just use that only. Now, what are the minimum requirement levels for the levels? It should identify of the chemical hazardous. Is it hazardous or not? For that, you can mention there is a diamond ring also called. I will not go in detail, otherwise it will be further long. there's a diamond. On that you will get the rating. Individually I gave on this training. Then appropriate hazardous warning, name and the address of the manufacturer or the importer, target organ effect. All these you will get from here, MSGS. All this information is there. That's the MSGS important. Identity of the hazardous chemical, you also find this on the MSGS, and hazard warning information. Now handling chemical in emergencies. First, very important, everyone should have to know the emergency number, and here everyone have to save that number in your mobile. And if there is a calling issue, we have the Wi-Fi facility, so use that facility. Okay. So know how to control the spill. We have the special spill response team in each department. They are the one who will respond on this situation. No proper equipment shutdown procedures. This one will nullify only the experts. Not, if you know, it's very good, but prefer to give this chance to the expert. No proper evacuation routes and the assembly areas. This is, everyone have to know that where is the assembly point, nearest assembly point. In the, for example, for FMD building, where is the nearest assembly point? Anyone?
Near mosque.
Yes, exactly. You see mosque area, behind there is a, that's the where we have to, if any situation happen, everyone should have to come there. That's our assembly point. So this should be important. And every guys, still housekeeping guys, you all are going each buildings. So ensure that nearest building you have to knowledge that where there is assembly point. Because you maybe, if something happens, Nozbillah, then you are the most important person, because you are the one who they will lead. Because I don't know how much time they will take in response. So you guys will have this very important role, that you should have to tell them, move, go to assemble in the assembly area. Now, what emergency personnel should know? Like for the expert, this is, he knows how to clean up the procedure. He knows the disposal procedure. Like for example, any spill response team person. So this is for the expert one who is dealing with. Use of the cleanup equipments. For generally we have these where you find these cleanup equipments and other things. In the spill kit. We have a spill kit near all the sensitive zone. There you will find so many different items, especially like starting from absorbent pads and other things, including shovel and the brushes, these things. Firefighting and the other emergency measures. So here we have a special team for the fire. Who is that? Anyone? Knows, everyone knows who is taking care of our fire incident things?
Fire department, you mean those people?
Yeah.
Circuit.
Everyone, I think. All of you know this?
Yes.
We have CERCO. If any incident happens with regarding fire and safety, they are the one who will respond this. So you also have, we have here 4 numbers. First help desk, then we have cleaning. For cleaning we have day and night shift. So there are 3, and the last is CERCO. And use of the other emergency equipments. First aid for the chemicals for the eyes. This is for the first aid. You can see if something happened. So first you should have to respond if possible, to eliminate the major consequences of that effect. So for that, in case of eyes, what you will do? So don't rub the eyes. This is very important. Why? Because if you rub, it will spread further. You know, if someone is Nozbillah got bitten by the snake, what actually why he got infection very fast? You know?
Panic.
Yeah, exactly. And what happened during the panic? Your blood circulation rise, and when your blood circulation fast, they will carry that poison throughout your body very fast. I know it's very easy to say calm down, because that situation is not that but still, as much as possible, just make sure you calm down yourself, because as you calm down yourself, your blood circulation will be slow. So that's why sometimes I have seen, not but in the movies, that sometimes if there is something like, they just nearest cut the vein for that, because at least so that it will not flow further. But that's not only taken care by the expert. Otherwise, Nozbillah, if you cut the main vein, because of the blood. So it should be done by the expert. So first, don't rub the eyes. Next, hold the eyelids open and flush with the water for minimum 15 minutes. This is the requirement. Here, I think we have one in this laundry. Even though that force is still not very much compatible, but it's still good. But I think yesterday they have one bigger observation. I think.
Yeah, just to
Yeah.
clean this.
Exactly.
And then fill with the
Distilled water.
Distilled water.
Exactly. So what you should have to do when there's something happen, just open your lid as much as possible and try to flush the water. If even that water is not possible, then you can manually like this. But it should be fast. And as much as water you can put in your eye, into your eye, do this. Be careful not to contaminate the other eyes. It means if something happen, like you will order put, it should be taken care well. So at the end, you should have to additionally taken for medical attention if there is a requirement. For the skin, flush the area with lukewarm water for the 15 minutes. If there's something like happen, but not in the case of acid. Don't do this in the acid. If something happen like acid just splashes on your skin, what you should have to do? Don't put water first. This is very important. Try to take any, like you have tissue paper, especially the cotton cloth. Don't use tissue because it will burn, it will further stick on your skin. So take some cloth, just try to soak that and then only put the water. Don't directly put if there is a spillage of the skin on, acid on your skin. It will further cause this. Remove clothing and jewelry from the burnt area. This is very. I have seen one of my friend is a doctor. He told me that he has a case. In our Darbhanga we have DMCH, government hospital. There was one case of a girl just burnt, and the bad happened with her is that she wore a polyester dress, and that become actually disaster for her. Polyester is very flammable, right? Very easily. And what happened when she got fire? What happened? That polyester just stick onto her skin. So when they are removing, actually what happened? The skin at the same time coming out. It was very painful. So that is why we should have to wear one of the special dress when you are. Generally, we are not following in our. Generally, when we are dealing with food, kitchen, here we are. I think. But in our house, generally we are not wearing that special dress. It should be. Your little careless causes serious consequences. Every woman should have understanding of when something happen like LPG leakage, how she should have to respond. We are the one who is here and they are the one who will respond on that. So these are some small training we should always convey to our ladies. So they are may ensure that their safety, own safety. So remove clothing and jewelry from the burnt area. Seek additional medical attention. Very important. For first aid for the chemical inhalation. Move victim to the ventilated air. For example, if somewhere he in the confined space, take him into the open air. So it will have proper, you can say, oxygen, and then get immediate help. And there are there we have some PRP also we call. It's important, but it should be done by professional. But if you have a knowledge, like for sometimes I saw a video. The boy is age maybe 7 years, I think. Her mother sudden have a cardiac arrest, and she was like start tumbling, and then she just, and that boy still was playing game. I just saw, and I was just shocked his response. He was just playing game, and while he just saw that her mother is just not doing good, so he just put his game and he just tried to try, and when her mother start feeling good, he again came and started playing game. So it shows how good he is in that. His mind is still here, I think. But in the meanwhile, he saved her mother's life. I think in our India, and this is not a culture, but this is very important to educate your children and the elder one if something happens. Generally in our India, we have so many cases like the children just swallow the coins or something. You should have to know how to respond that. For that, as per the expert, what you should have to make your finger like this and put here, just below this one, the diaphragm here, and below just and bend the pelvis and just push like this. So maybe it will come out. If further not coming, if your boy is conscious, then take him to the doctor. This is very important information. If sometime happen due to our carelessness, we suffer the life of that baby. Now, this is brief, that what are the major type of health hazard we might have if we are dealing with any chemicals. Like corrosive, if there is some corrosive, it will cause tissue damage and burns on the contact with the skin and the eyes. If something is primary irritants, it will cause eyes, redness and swelling of the skin. Then sensitizers cause an allergic skin and the lungs reaction. Acute toxic material can cause adverse effect on even at the very low doses. If there is a low dose of this sensitizer or acute toxic material, it will impact your body. Then carcinogen may cause cancer. There is some, I just forgetting the name of that chemical, which may cause you cancer. So it should be taken care of very well. One we have here, but it should be dealt like perchloroethylene, also considered to be as a very highly toxic, which is we are using right now in our central laundry. So organs are specific towards some of the there are some specific chemical which might impact your lungs, that special organ. You know, due to the negligence of this only, on an average more than annually 2 lakh people die due to negligence of just not handling properly to the chemicals. More than 2 lakh as per WHO, World Health Organization. So I think it's now over. So anything you have, any questions? You're most welcome. Thank you so much then. Everyone please just, where is